Have you ever noticed that what you eat can sometimes make a big difference in how you feel, especially when it comes to your joints? It is a question many people with arthritis ask themselves, wondering if their dinner plate is contributing to their discomfort. You are not alone in this thought, and it is a very insightful observation to make when managing your overall wellness. When it comes to red meat and joint pain, the direct answer is that for some individuals, particularly those with inflammatory conditions like certain types of arthritis, excessive consumption of red meat can indeed exacerbate symptoms and potentially increase joint pain. This is primarily due to specific compounds found in red meat that can promote inflammation within the body. However, it is not a universal truth for everyone, and individual responses can vary greatly. The core mechanism behind this connection lies in the types of fats and other substances present in red meat, especially processed or high-fat varieties. Red meat contains saturated fats and, in some cases, can be a source of omega-6 fatty acids, which, when consumed in excess relative to omega-3s, can shift the body towards a more pro-inflammatory state. Additionally, a compound called N-glycosylneuramic acid, or NOI5GC, a sugar molecule not naturally produced by humans but found in red meat, can be absorbed and trigger an immune response, further fueling inflammation in sensitive individuals. The cooking method also plays a role, as high-temperature cooking of red meat can create advanced glycation end products, or a GES, which are known to contribute to oxidative stress and inflammation. So how can you navigate this information in your daily life? The key is thoughtful moderation and conscious choices. Instead of completely eliminating red meat, which can be a good source of iron and protein, consider reducing your intake to perhaps once or twice a week. When you do choose red meat, opt for leaner cuts and prepare it with healthier cooking methods, such as baking, stewing, or grilling at lower temperatures. Complement your meals with plenty of vegetables, fruits, and whole grains, which are rich in anti-inflammatory nutrients and fiber. Pay attention to how your body responds after different meals. This personal feedback is invaluable in identifying what works best for you. An interesting detail to consider is the role of the gut microbiome. Recent research highlights that our gut bacteria play a significant role in how we process different foods, including red meat. A diet high in red meat can alter the balance of gut microbes, potentially increasing populations of bacteria that produce pro-inflammatory compounds. Furthermore, the type of red meat matters. Grass-fed varieties tend to have a more favorable omega-3 to omega-6 ratio compared to grain-fed, offering a slightly different nutritional profile. Understanding these nuances empowers you to make even more informed choices for your joint health. Ultimately, recognizing the potential link between excessive red meat consumption and increased joint pain can be a powerful tool in your arthritis management toolkit. By making informed dietary adjustments, such as moderating your intake and choosing leaner options, you are actively supporting your body's anti-inflammatory processes and working towards greater comfort. Remember, your food choices are a vital part of proactively managing your symptoms and enhancing your overall well-being. Always consult with a healthcare professional or a registered dietitian for personalized dietary advice, especially if you have specific health conditions.